Hi guys, how are you doing? It's Elaine Bintz, certified health coach and personal trainer, and we are on day 15 of our 30-day health challenge. We are halfway to 30. I hope everybody is having a great weekend, and I hope you're having a great year so far. So today's topic is the third day in the series on macros. So today's topic is fat. This will be a shorter video today than the prior two videos. So fat as a macronutrient. What is fat and what is the purpose of fat? So in your body, you need body fat. You need a certain amount of body fat. There are some definite indications if you are not getting enough dietary fat, which we'll talk about a little bit. So there's a certain amount of body fat that you want that's in an ideal range, which a trainer can test for you. We can measure. You can go to a physiology lab. A lot of times you can measure on those scales to find out what your body fat is. But dietary fat plays a role in your body. There are so many awesome functions of fat. So how much fat do you want? You want to eat 20 to 35% of dietary fat. So if you notice, this range is actually a larger range than protein. So a misconception I hear a lot is I want to eat low fat, low fat, low fat. That's the way to lose weight. That's not necessarily the best approach, depending on how your body responds to eating lower fat diet. Because sometimes you try a low fat diet and then your body craves more calories, and then you overcompensate by eating more calories, and then you don't end up losing weight in the end. So what are some of the functions of fat in the body? Protect your organs. So yeah, you want to have fat, visceral fat, that's in between the organs to make sure if you do experience some sort of a blow or an acute event. I work with clients who are firefighters and paramedics and teachers and police officers, or they work in the steel mill. So depending on their career, their profession might demand that they have a particular physique or amount of body fat to withstand whatever their career circumstances are, to protect their own body, in addition to their professional gear that they're wearing for work. Warmth. Sometimes I have people come and tell me they are cold all the time. So if you're not eating enough fat, dietary fat in your diet, you might actually be cold because the metabolism, if you're not eating enough of a percentage of fat, the insulation that your body needs, you might not be getting that, and then you'll feel cold. Absorbing nutrients. So there are 4 fat soluble vitamins: vitamin A, vitamin D, vitamin E, and vitamin K. So K is like for clotting, E helps with like cells in your skin, and then D will help with bone production and maintenance of bone mineral density, and then vitamin A like your eyes, and there's a lot of other functions. But if you're not eating enough fat, those 4 particular vitamins, vitamin A, vitamin D, vitamin E, and vitamin K, these 4 vitamins cannot get properly absorbed and used in your body if you're not eating enough fat, because fat is the transportation unit in order to absorb those vitamins in your body. And then producing hormones. So we talked about this a little bit in the cholesterol video earlier in the challenge, but dietary fat actually helps your body produce and regulate hormones. So what are hormones? You got a bunch of hormones: glucagon, insulin, cortisol. You have your reproductive organs, your estrogen, your testosterone, all of that. So I am a prenatal personal trainer. So I will help clients through the process of getting pregnant, during pregnancy, and then postpartum. And just a reminder, if you have ever delivered a baby, you are always postpartum after that event. But the process of pregnancy can be a little tricky, and I am just a bachelor level educated person, so I highly recommend, if you do have fertility concerns, you go to a fertility specialist. But if you have not enough, so if you are underweight or under fat, or if you are overweight or you have too much body fat, you can have fertility issues with getting pregnant or bringing a baby to term if your body fat is not within this particular ideal range for your body. So that's not to say there aren't other factors. There's so many other factors related to fertility, but it would be worth checking out to see, based on your body's hormone panel, and if you are trying to get pregnant, if you're eating enough fat, and then the healthy fats. So again, this topic, macros, I hope the past few days have been really useful for you in regards to calculating what you need in your diet. Of course, I always encourage you to eat the healthier versions, eat your fats that have like nuts and seeds and avocados, things like that. I'd more prefer that you eat those, like olives, versus like trans fats or saturated fats like your cookies and crackers, those sorts of things. One of the diets people have been asking me about for several years, which has been a very hot topic, is the keto diet. So if you're not familiar with keto, it puts your body into ketosis, which is just a different delivery pathway in order for your body to use energy. So the keto diet, if you've ever seen the keto pyramid, it has a extremely low, this is an example of one of the many low carbohydrate diets. So 5% of this diet is carbohydrates, and then you have 25% of your calories coming from protein, and then 70%, 70, that's a lot. It's a very high fat diet. So the keto diet, it came from a physician who was treating epilepsy. So if a person had been experiencing seizures, they found that this high fat diet and very low carb diet was effective as a therapeutic diet for people who were experiencing epilepsy. So naturally, in the fitness world, there's a little bit of research that's done, and then a bunch of people try to apply it into the everyday person in the market. So keto in general, one, am I usually in support of it? No, I am usually not. As a nutritional professional and going with the Academy of Nutrition and Dietetics, unless you have been prescribed this diet by your doctor or your dietitian or a nutritionist, I'm not a big fan of keto. It can help you to eat higher quality carbohydrates and make better choices if you try keto for a short time period. Of course, I do not recommend if you have some sort of a metabolic disorder, like if you have diabetes, I definitely don't recommend that you try the keto diet. But the challenge becomes, and I found a lot of people there, and there's apps you can use on your phone if you wanted to try it for like a week or two and see if you like the keto diet, or just if you just wanted to toy with it. It's hard. The feedback I have received from my clients who've done keto is it actually is really hard to eat that much fat. And another consideration with this particular diet is if you are not eating enough fiber. So usually fiber is a component that is found in carbohydrates. Well, if you're only eating 5% of your calories from carbohydrates, you are probably not eating enough fiber. Women, we want about 25 to 30 grams. Guys, you want like 30 to 35 grams of fiber per day, and fiber helps push things through your digestive tract and then helps you to eliminate them. And then, fiber helps with a lot of other functions in your digestive system. So some of the feedback I've gotten from my clients who do keto is they may have constipation or they may have issues with digestion. So I'm not 100% in support of keto, but yes, there have been some clients I've worked with in the past who have started keto as a jump start in order to help them have a better relationship with food. And of course, I 100% support eating a quality diet. So again, this is day 15. We're halfway to 30. It's fat as a topic. My name is Elaine Bintz, health coach, personal trainer. I look forward to seeing you guys tomorrow. Have a great day. Bye.